Verso quali traguardi stanno andando le ricerche sui nuovi farmaci per l'emofilia? Soprattutto quali saranno i benefici per i pazienti? L'abbiamo chiesto alla professoressa Ana Boban, vicepresidente dell'EAHAD, l'Associazione Europea dell'Emofilia, che abbiamo incontrato proprio qui a Milano in occasione del 18° congresso annuale di questa importante associazione. Which are the new technologies arriving on the market in the next couple of years and which are the improvement for the patient connected with these new technologies, with new class of drugs?
So far, we have been treating hemophilia patients with prophylaxis with solo factor concentrates, but now we have new therapies that are easily to administer, so to decrease the treatment burden in patients with hemophilia, but with better efficacy. So we have gene therapy coming up, and we have a couple of molecules that are applied subcutaneously. We're already using factor VIII mimetics, emicizumab, for a couple of years. Now we have new bispecific antibodies, and then we have molecules that they're working in different way. So we're rebalancing hemostasis, like TFPI inhibitors. Now we have one that is approved in Europe for patients with hemophilia B and inhibitors. We have fitosteran, small interfering RNA molecule that interferes with the production of antithrombin. So again, rebalancing agents for treatment of patients with hemophilia A and B, regardless of inhibitors.
And generally speaking, which are the benefits for the patient? Which is the area of improvement in the real life?
So in real life, we are able to diminish or spontaneous bleedings. So that's the main problem in patients with hemophilia. But the treatment burden is high. So if you have to apply factor concentrates 2 or 3 times a week, that's really high burden. But now we have new factor concentrates with using novel technology, so to be applied just once weekly, already approved in Europe. And we have these subcutaneous drugs, so it's much easier to apply injections subcutaneously than intravenously. And the efficacy for prophylaxis is very good.
You mentioned this new class of TFPI inhibitor. Recently has been approved the first drug to treat a very difficult subgroup of patients, those with hemophilia B and inhibitors. Which is your comment about the class in general, how it works, and about this specific drug, whose name is concizumab?
Concizumab, yeah. That's a new TFPI inhibitor, now approved in Europe. That's a drug that works on rebalancing hemostasis, so to enhance strong generation irrespectively of presence of factor VIII or factor IX. And that's good because then it can be treated also patients with hemophilia A and B, and inhibitors and without inhibitors. And the patients with hemophilia B and inhibitors are really in need because so far we have no good drug, no good prophylaxis for them. So they are the only group of patients with hemophilia with no available prophylaxis. And this drug will really change their lives, as it was done with emicizumab, which was the first drug that could be used for prophylaxis in patients with hemophilia A. TFPI inhibitors, however, will be able to treat also patients with hemophilia A inhibitors and hemophilia B with inhibitors.
You mentioned also the bispecific drugs, which is an evolution of the simple.
So bispecific antibodies like emicizumab was the first out-of-the-box treatment for hemophilia. It was the first that was not concentrated just on a factor concentrate, but something else. And now we have also second generation. The clinical trials, the frontier trials are in line. So now we are going to, tomorrow we'll go hear the results from the phase 3 MIMATE trial, which is also bispecific antibody used for patients with hemophilia A, irrespectively of inhibitors.
And which is the progress of this second generation?
We hope it will offer better protection for bleeds per patient with hemophilia A.
So when you now meet a patient with the parents, no, and the diagnosis is hemophilia A or B is the same, how you paint the future for this girl or this boy?
So the future for patients with hemophilia is really bright. So if you compare the treatment and treatment outcomes of patients like 10 or 20 years ago, and now it's really big difference because of availability of different drugs. There is another need for education of patients with hemophilia because they're the ones that are applying prophylaxis at home. They have to understand how the treatment works. They're involved in shared decision making, so they're actively involved in the choice of drugs. And to do that, they have to know a lot. So we have to educate them. And the big issue is to make these drugs available to all patients with hemophilia. Unfortunately, in Europe, we are lucky because the majority of countries have access to all the treatments. North America, Canada, but for some parts of the world, the treatment of hemophilia is still not possible.
So we hope that it will improve also in those countries.
Yes, of course.